The right to health care remains a critical right embedded in Section 27 of the country's constitution. The World Health Organization's constitution reaffirms that the highest attainable standard of health as a fundamental right of every human being is central to patient care. Furthermore, the South African Human Rights Commission places quality of service alongside the right to health care. But many patients' experiences tell a different story.
What I would like is hygiene. It's a bit dirty, yeah. Concerning the services at the pharmacists, there are people who come here from other places. They come here around about 3 a.m. in the morning. Others even sleep here.
If they can give us the rights, because we're not just things, we are patients and we are people. We need to have our voice heard.
It made me feel less of a human. I felt like an animal. I didn't feel like I'm being welcomed in Rahima Musa Mother and Child Hospital.
The Human Rights Commission remains concerned about the persisting challenges that pose a threat to the realization of the right to health care.
It's important that we highlight that it's a protected right in terms of the Constitution. In terms of Section 27, we have to talk about the infrastructure. We have to talk about the medicine. All of those things are things that must be readily available for us in order for us to give effect to this right to health care.
Ailing infrastructure is among the most compelling areas of concern, evidently a barrier to accessing healthcare services.
The key issue, I think, is maintenance. When we see what we're currently experiencing in terms of the infrastructure, particularly in some of the older hospitals in Gauteng, and what we've seen is that if there's no maintenance of the infrastructure, if there's no maintenance of the machines and the equipment that is available, the right becomes futile.
Factors that compromise the patient's experience at healthcare facilities are attributed to, among others, leadership, funding, and corruption. Social justice advocacy group Section 27 says these challenges continue to impair the delivery of health rights.
So we can see some systematic high-level issues, including management and governance problems, including budgeting and corruption. And all of these things really directly impact on the experience of patients who have a right to access healthcare services and who are unable to realize that right or have that right realized because of the various health system problems that we're seeing in this province and elsewhere in the country.
Meanwhile, the Gauteng Department of Health says there are measures in place for patients encountering challenges at health facilities.
At all our facilities, we've got what we call quality assurance managers or offices, where if you are unhappy about the level of service that you have received, you are able to actually drop in your input, give us your feedback immediately.
While access to good quality healthcare is key to patient care, it has become apparent that more patient knowledge on health rights is equally important, yet lacking. According to the National Health Act, full user knowledge is among the rights patients need to receive. Zandile Myeza, SABC News, Johannesburg.